Good evening and a very warm welcome to all to our webinar jointly hosted by GenesisCare and Penny Brohn UK. My name is Sally Sadiq and I work for Penny Brohn as Partnership Lead with GenesisCare. This session lasts an hour and we will be recording it so both organisations can use it to further help more people with cancer. We will be using a short polling questionnaire at the end of the session as we are keen to know if the session has met your needs. Your answers will be anonymous. Today's session is part of a series of webinars treating the whole person, which will cover various ways that cancer treatments like surgery, radiotherapy and chemotherapy can be combined with lifestyle and complementary approaches to help reduce side effects and improve outcomes people affected by cancer. Today's topic is COVID and cancer. Dr. Catherine Zolman will be posing questions to our panel guests. If you would like to ask questions on this topic, please use the Q&A function. I will be keeping an eye on the questions coming in and raise them with the panel if time allows. We may not get a chance to answer all the questions in the limited time, so please bear with us. And note that the panelists will not be able to answer any questions that relate to individual circumstances or cases. All opinions are the panel's individual opinions, and they are not representative of either organisation. If you would like any more information about GenesisCare and Penny Brohn, you can see the slide at the moment. We will show this again at the end of the webinar. And now over to Catherine to start.
Thank you very much, Sally, and it's a pleasure to welcome you to tonight's webinar. As Sally mentioned, the topic is COVID and cancer, and I'm delighted to be joined by Professor Rob Thomas, who's a consultant oncologist in Bedford and Cambridge, well known for his work on lifestyle medicine and its impact on cancer, and now for several books that he's published. We've also got with us on the panel Jashila DeVille, who's a physiotherapist and the head of exercise medicine at GenesisCare, and Hannah Light, who's a counsellor working with people receiving cancer treatment through the GenesisCare Penny Brohn UK partnership. So we chose this subject because COVID has had a massive impact on the cancer community, on patients, on staff, on friends and families, both in terms of hospital management and in terms of what people can do at home. And integrative cancer care is that intelligent, safe and evidence-based combination of conventional medicine approaches alongside lifestyle and complementary therapies that can really help people to manage whatever challenges they're facing in related to their cancer, but also to help people build resilience. So we felt that many of the topics that were relevant to how to support people through integrative approaches with cancer were also very relevant to supporting people through COVID. And so we're going to be discussing various topics and hopefully helping people come away with some practical tips and suggestions of how they can really help themselves and understand what's going on and what approaches might be most suitable and most appropriate to use. So my first question, Rob, is to you. I mean, obviously as an oncologist, you've seen that cancer has had a big impact on cancer services, both in terms of diagnosing new cancers, in terms of treating existing cancers. Can you tell us what the main consequences have been from your perspective?
Yeah, thanks, Catherine. I work in a sort of a DGH setting as well as a teaching hospital setting. So there's a number of things. First of all, people have been having trouble getting hold of their GP and getting their initial appointment. They've been a bit nervous about going to the doctors as well because they're worried about catching COVID. So that's actually resulted in when maybe a couple of years ago you go to the doctor earlier with a lump in your breast or a symptom of cancer such as blood in the urine. And that means because of this delay, we're seeing much more later stage disease. So, for example, disease spread to the lymph nodes or bigger tumours in the breast, which has knock-on consequences. They're more likely to need chemotherapy. They're more likely to need, say, a mastectomy rather than a lumpectomy. And, of course, the prognosis is worse. So that's a bit upsetting. And then once, actually the 2-week rule for seeing people with cancer has not changed. And we've still been working flat out as well as helping on the wards for COVID. So, we're busy times, but anyway. So, once they're in the system, it's fine, but then their choices become a little bit limited as well. So for example, a man with prostate cancer might, prefer surgery. Well, for half of last year, the surgeons weren't operating. Actually there are alternatives. Radiotherapy never stopped completely, but we were using delay tactics. So for example, if you had a man who didn't need urgent radiotherapy, we always carried on with urgent radiotherapy, but say they needed radiotherapy, which could be deferred if they had hormones, for example, which on a cancer perspective isn't bad. You can give hormones for maybe up to 2 or 3 years and delay the radiotherapy. However, the impact on that patient is quite incredible. We may normally only give hormones for say 3 or 4 months, but men were now put on hormones for say up to a year, which means they're more likely to get memory problems, gain weight, mood changes, hot flushes, erectile dysfunction, all on top of being isolated and things. So you can imagine the cooking pot of sort of distress which is going on. So yeah, and then of course they're catching COVID when they come in. That's the other thing. I mean, you send them for a bone scan. If they turn up, you wonder why they're not in clinic 2 weeks later, because you find them on the medical ward, on oxygen. So and that of course is bad for them, but of course it then delays chemo, delays radiotherapy. So those are in a nutshell, I think, the problems.
Absolutely, and as well as being medical lead at Penny Brohn, I work as an NHS GP, and you're absolutely right that we've seen a dramatic drop in the number of people actually willing to come to the GP. They sometimes got quite worrying symptoms, but they're too frightened to come out. They're too frightened to kind of sit in the waiting room. We're doing an awful lot of appointments on the telephone, and really many people are finding that very satisfactory. But obviously there's an awful lot of things that you need to see in person, and so we're trying to persuade people that absolutely it's more important for them to come and present and be diagnosed quickly. And I think that message is a really important message. I think a lot of people are, GP practices are generally very safe places. We've distanced our waiting rooms. Everybody's wearing appropriate PPE, and now hospitals are much safer places as well. And a lot of cancer centres are as clean as they can be. So I think the community's general message is that you are probably much safer coming to the doctors and getting the tests that you need in an early way than you are waiting at home until things blow over. But as Rob said, possibly leaving a cancer to grow where the treatment options might be less favourable. So Hannah, I mean, you've been seeing a lot of people either diagnosed through this lockdown or receiving treatment through this lockdown. What have been some of the psychological and emotional consequences that you've picked up in the people that you're seeing, either the people who have been diagnosed themselves or maybe in their wider communities or circles?
Well, I mean, I think, obviously it's been a really difficult year for everyone. And I think whilst everyone's circumstance is quite unique, because everyone deals with things in slightly different ways, but actually there have been some quite strong themes that have come out in the work that I've been doing with people. And sometimes that can give people a little bit of comfort to recognise that they're not the only ones feeling a particular way. And very recently, just in the last few weeks, actually, there's been a real sense of sadness coming out. People talking about really, how sad they feel about the last year. And that might be combined with actually us reaching this year anniversary that we've met this week. And I think whenever you hit a year anniversary of any life event, actually it gives rise to a sort of natural reflection and contemplation. And people have felt a great sadness about all the losses over the last year. And obviously losses come in all different forms. And there's been a loss of life, which obviously I think this week nationally we have recognised, whether that's been directly due to COVID or indirectly due to COVID. But there's all sorts of sadnesses and losses that have come up for people. So all the losses of events that people haven't been able to attend, all those things we look forward to each year, the kind of celebrations, the getting together with families that just haven't been able to happen, and they have a real emotional impact, and I think they have a cumulative effect over a period of year. And I think something that's come through very strongly with patients is a loss of time, so a loss of a whole year, which actually a year is a long period, and for patients who have a cancer diagnosis, obviously time becomes really precious. So to have lost a whole year of being able to make memories, spend meaningful time with the people close to them has been really, really hard. And then when you lump that in with all the fear and anxiety, so there's fear and anxiety and a huge unknown around COVID. And also for patients as well, there's a fear and anxiety and an unknown about their health. So you have that. And then you also have the isolation. People haven't been able to take their loved ones to their appointments with them. Maybe they've had to go to appointments and actually receive bad news on their own. So a lot of people I've spoken to have felt very isolated, and that they've been doing that journey on their own. So when you kind of look at that broad picture of all those things I've mentioned, the kind of sadness and the loss and the isolation and the anxiety and the fear, you really get a sense of how challenging time has been for people over the last year. But having said that, something I've recognised is a great deal of resilience. And, you know, I'm hugely privileged to work with just some amazing people. And particularly over this winter and this last lockdown, people have really had to dig deep to kind of get through. And I've seen that time and again, and people sort of say, oh, but that I've had no choice, I've had to do that. And I feel that can be quite dismissive. And I always try to encourage people to recognise actually the resilience that they have found, even if they don't always feel it, and to sort of be a witness to their own resilience. I think that's really important.
Yes, thank you, Hannah. And I think that word resilience is so important and so relevant to today's situation. And I think it's interesting because I think early on, I was meeting people who'd been diagnosed with cancer, who'd already had to dig quite deep to find that resilience, exactly as you say, around that uncertainty and around some of the fear and anxiety that they were having to face with their cancer. So in some ways, they were telling me, actually, you know, COVID isn't stressing me out as much as it is stressing my neighbours out, because I've already had to deal with some of those things and find that those sort of strategies that really help me keep resilient and find that support. And many of them had already been isolating because they'd already started treatment or those sorts of things. So actually shielding and isolation are not new things for the cancer community, but they're very new for many others of us. So I think that theme of resilience, and is there anything that we can do as people working in this field, particularly with our broader toolbox of things that we can offer in terms of lifestyle medicine and in terms of other approaches, that really helps people support their own resilience? And I think one of the things that obviously does really support the resilience from the research evidence is physical activity. And Jashila, you run an exercise medicine service for people undergoing cancer treatment in GenesisCare centres. But I guess COVID has got some extra challenges, with many gyms being closed and many people with cancer shielding and scared of going outside. Has COVID affected people with cancer's ability and confidence to exercise? And have you got any advice or strategies to help them with that? Because I think we've covered some of the negative impacts of COVID in the cancer population, but I'm really keen that we also spend some time this evening exploring what can be done and what sort of strategies might help.
So definitely patients, you know, you mentioned the word isolation, and they've been isolating, and they've been, and that's caused quite a lot of anxiety, quite increased that feeling of loneliness, but it's also made people very scared to interact. And whereas before they might have met people that they usually go out for walks with, or their Sunday walks with, they met with their family, people are now scared to do that. And we've certainly seen that. So now that hopefully, fingers crossed, we're going to be seeing the end of this, you know, my advice to people is to slowly just start, you know, trying to go out, as in meet those friends or that friend. You can meet in 6, I think, if Boris lets us, on the 29th of March, you know, outdoors. And the thing I always stress to my patients is outdoors is where it's safe. So as you know, as long as you're meeting outside, it's good. I think if you're just sensible as well, and not meeting in big groups, and observing your social distancing and your proper hand hygiene, the mental health benefits that you're going to get from actually meeting someone and doing some physical activity outdoors is going to far outweigh anything else. So it's something that we all should be doing. The other thing I'd like to say is that there's been such a boom in online physical activity programs, and certainly at GenesisCare, we've moved some of our patients, onto an online program, and actually been able to reach more people, especially those that haven't been able to, or too scared to go out, or shielding, etc. So where I know Penny Brohn offers some online exercise classes, and I always urge my patients, look, if you don't feel comfortable going out, it's important to do physical activity for all the benefits that we know. So go and look at Penny Brohn. I always refer them to Alice's classes and say, join them and do them, because at least you're getting some of the benefits and the physiological benefits from exercising. And just, the more you're out, the better it is. So even if it's just for a walk, it's really, really good for you.
Yeah, absolutely. And I think you're right. This expansion in online and people joining yoga classes or Pilates classes online, and the sort of encouragement and some of the amazing sort of challenges that people have set themselves. Just obviously, we normally as a charity rely on people running marathons for us and doing sort of big sponsored events. Obviously those haven't been possible, but people have found amazing creative ways to be active in their own homes, or as you say, to go out early in the morning before other people are out, or to sort of use access to green spaces and sort of places where they can distance but also get the benefits of being out in nature, because I think
and that is something that I have told my patients, because they were like, I do miss my walks, and this was during the first lockdown, and I would always tell them, get up really early and go out, and when you're out at 5:30 in the morning, aside from a few avid runners like myself, you hardly see anybody. I run and I sometimes don't even see a single car at that time of the morning. And some of the patients have actually taken that up, and a couple of weeks later have come back and said, you know what, it's actually made me feel back to gaining some normality in this. And I think it's, that's where we need to start making these small little concessions with patients to say, let's try and get back some control, because otherwise they go back to feeling lonely and scared, and the anxiety increases.
Absolutely. And Joshua, what about, I think as well as doing physical activity, there's also not sitting down for too long. And I think our whole Zoom culture now, where people are sitting for hours and hours on screens, have you got any tips for how they could kind of break that up? Because sometimes people are very good about doing their exercise, but they're also then sitting for sort of 6 hours, 7 hours on the chair.
Yeah. So I, with the patients that work, I often tell them, look, make sure you're getting up, every hour, at least twice in an hour. And luckily, all the watches these days, you can set them to buzz, and they will buzz to tell you you've been sitting too long. And sometimes you don't have the capacity in your work to actually leave, but all you need to do is just stand up for a bit. And maybe that phone call you're doing is stand up. I know that there's been a boom in those standing desks, or getting those things that lift up your computer. And I always encourage people to change position as often as possible, within the hour. So it's not as, we should sit and then get up to have a coffee and then get up to go for lunch. It is about that movements within the day while you're sitting at your computer. So very important.
Fantastic. So Rob, obviously it's early days and there's not much COVID specific research available yet, but what does the available research say apart from physical activity? Is there anything else that you feel people with cancer should be doing to help themselves minimise the chances of getting severe COVID, help them recover well and quickly if they do get COVID, and help them reduce the chances of COVID disrupting their cancer treatment? I know you've been very active thinking about this and researching about this area.
Yeah, well, as you know, we have a sort of lifestyle research unit and a main cancer unit, which we've had to put those trials on hold. So we decided to turn our energy towards COVID. So we designed a study actually looking at patients who've caught COVID to see if changing their gut health and increasing the number of specific healthy foods could shorten the duration of their symptoms and also prevent long COVID, or if they've got long COVID, to shorten or come out of that. So we've nearly got to recruitment. We've got 10 patients left, so it's going to be 150 patients, and that's and the hypothesis for that is that we believe that people with poorer gut health, and the lifestyles which create that, means you're more likely to get issues. And the reason is, everyone talks about the gut-brain axis, you know, that it's a second brain. But there's a very strong gut-lung axis. In fact, people with respiratory distress, you often, if you measure the microbiome of the lung, it's actually very similar to the abnormal gut bacteria in the gut. And so because of the leaky gut you get, it leaks into the bloodstream and affects the lung. So when you get a viral infection, you get this horrible excess inflammation, or the cytokine storm, which is actually the fatal element of the disease. So the hypothesis is we give them all a probiotic supplement, a Your Gut Plus supplement, which was designed specifically for the trial, and they're randomized to a pill which contains it contains a whole lot of polyphenol-rich foods such as aloe vera, chamomile, all of these which are shown in the previous SARS epidemic to actually have antiviral properties, which all sort of got lost in the sort of in the research stratosphere. But there's lots of data that these foods have direct antiviral properties. They also are prebiotics which help gut health as well. And indirectly, they also help mood and all sorts of other things. So that's the ongoing study, and we'll get the results in a couple of months, and we're trying to do rapid access publication on that. But in the meantime, as part of the research we did for all that, as you coming back to your question, we looked at all the other things which could possibly help. We know, for example, if you look at the New York data from April, of the 23,000 people who had unfortunately died at that point, only, well, not only, I mean, there's still 99 people tragically died who didn't have a comorbidity. So 99.1% of people had comorbidities. So we know that comorbidities are a very serious consequence, as well as age, but of course age and comorbidities are correlated as well. So can you change your comorbidities quick enough to lower your risk of COVID? Because I mean, it's taken years of problems, and not all comorbidities are lifestyle related, but many are, so we don't want to blame anyone for catching COVID. And if nevertheless, what you did 20 years ago is too late to change. But can you change? Well, you could start by trying to reduce weight a little bit, or certainly not put on any more weight during lockdown. We know, so that's a weight issue, but the process of losing weight actually improves your physiology. Even if you go on the scales and you can't see a change, it's been well known that if you, in the process of losing weight, your estrogen levels come down, your gut health improved, your chronic inflammatory markers come down, even before the scales change. So try to lose weight. Vitamin D deficiency, that's well established now. And it was, I literally was cringing when I saw those 3 people on, the news in March last year saying there's no link to vitamin D. They could have just said there's no proven link, but in the meantime, it might be a good idea to take some, because obviously all the data then came out showing it's a major risk factor. Not taking too much vitamin D, but being deficient. So Drusella, back to your point, when you're outside, you're increasing your vitamin D. So that's a big point. If you're not outside, take a supplement. Just mentioned gut health. So all the things which improve gut health, which is what you advocate in Penny Brohn, eating bacteria-rich foods, kefir, I just had some kimchi tonight, which and we'll have some kefir, mushrooms, all the prebiotics, and exercise and reducing processed sugar intake, all the things which help gut health. Psychological stress, we know that affects gut health, and that's harder, I have to say, to change from the reasons you've just all highlighted. The other things we've noticed, just on a minor phone, hot and cold showers. In the Cold Institute from 20 years ago, they said that's actually a very simple strategy to improve your brown fat and improve your immune status. And just making sure you get plenty of fresh air and those sort of things. So the common sense things persist. We'll know from the trial whether actually taking a probiotic or a supplement on top of a healthy diet would help, but we don't know that for sure just yet.
That's really helpful. And I think from some of the cancer literature, we know that sometimes taking a supplement isn't enough to correct a sort of deficient diet, but it can. I think the one exception to that, as you say, is vitamin D, which you really can't get in the diet. So again, I think many GPs, many oncologists are very happy to check people's vitamin D levels these days, and you can then take the right amount of supplements to correct your particular situation. Some people need more vitamin D, some people need less, but in general, it seems, as you say, a sort of a fairly obvious and very safe thing to do.
Just on that point, there was a publication from Cambridge last week which said that 56% of us are vitamin D deficient. So, and it's not unlike vitamin A and vitamin E, which you can take too much of. And I would not recommend those vitamins unless you know you're correcting a deficiency. It's very hard to sort of completely overdose yourself with vitamin D unless you go, extreme. So I think it's a fair bet that to take a supplement in the winter would be good advice, I think.
And I think that's also especially important for people like me, of Indian origin, who comes from a very warm country, and they come to England and the sun is not strong enough. I think it's really more important for darker skinned people to make sure that they take in their vitamin D, because the sun just isn't strong enough in England to give you that vitamin D conversion that you need.
Yeah.
So I often tell my patients that.
And I think our advice, again, it's a fine balance, but I think our advice about sun protection has been so strong that so many people are not even going out in the sunshine without their factor 50 on their skins. And I think a balanced recommendation would be, when the sun's shining, it does need to be pretty sort of overhead for us to make vitamin D. So usually between 11 in the morning and 3 in the afternoon, but actually to go out for a little while without sun protection, not to get burnt, absolutely not, but to just enable your skin, because you won't be able to make vitamin D in your skin if you've plastered yourself head to toe in factor 50. And I loved what you said about stress and things as well. I think what we're finding is, as you say, that actually sometimes you can't do much about the causes of stress, but there are an awful lot of useful techniques which can change and modify the effect that stress has on your body and on your physiology. And simple things like breathing techniques can very quickly take you from a sort of fight and flight, sort of sympathetic overdrive, into more of a sort of parasympathetic system where your body is in its kind of repair mode, where your immune system is working a little bit better, where your digestion is working a little bit better. So even 5 minutes of gentle, quiet breathing, where the out breath is slightly longer than the in breath, where you're sitting quietly there, breathing with your belly rather than breathing in the top bits of your lung, can have been shown to make a big difference to sort of altering physiology and altering it really quite quickly. So I would say that there are little things that you can pepper into your day. When your watch beeps and tells you should get up from your computer, you could also just take 5 gentle breaths, and that also just helps to make a bit of a difference there. I think, Hannah, just coming back to you, I think as we approach the beginning of, hopefully, fingers crossed, the end of lockdown, I think that many people with cancer are kind of coming into a new source of stress. I mean, we've had the fear of going out, FOGO, that many people have described with cancer since the beginning of lockdown. But also now some of them are saying that actually, in some ways, a general lockdown's been kind of easier for them, because everybody's been locked down and they know that they're not really missing out on other things, or that it's been fine to work from home. As some of the restrictions ease, I think I'm certainly seeing a lot of people who are kind of quite worried about people sort of mingling more, and the risk of COVID increasing again, even post-vaccination, but more the fact that if they are still shielding as a result of their cancer treatment, that they're going to be really missing out. I don't know, have you got any suggestions of how they might manage that, or anything that people are finding helpful to navigate this kind of new situation?
Yes, and I think you're right. It's kind of, this is now the next phase, and it's another kind of readjustment now for people. And fear of going out is something I think, actually last year was quite a leveler in many ways for everyone. So I've had patients talking to me about that sort of fear of missing out. And actually they didn't really have that last year because no one was going out. So they weren't missing out on all the events. But now that restrictions are beginning to lift and people are noticing that actually, their social groups are planning activities for the summer, and people are, patients are now thinking, well, will I be able to go to that? And a nervousness around, rates may be rising as restrictions are lifted, and still a kind of fear around actually catching COVID and what that could be like for them, what that could mean for them. And in terms of kind of fear of missing out, I think for those people to really think about, during the kind of period of lockdown, what sorts of things did work for them, because we all kind of looked at kind of strategies that worked for us. So kind of do a little bit of a kind of assessment, which things did work, and kind of make sure that those are kind of embedded into routine and you're continuing to do some of those. And also talk to people. So if you're noticing that your friends or family are organising events, talk to them and let them know how you feel and that you still feel a little bit anxious. And actually that gives them the opportunity to include you in different ways. And also that then people don't feel quite so isolated. And also there will be things that people can do. So, hopefully as we're looking forward to hopefully having a decent summer and the warmer weather, but there will be opportunities for people to go out in a very safe way, even if people are still on active treatment. And I think it's really important for people to have things that they can look forward to. And actually having things to look forward to in the diary can be a real kind of uplifting and motivating feeling, and can help kind of shift a mindset and make people feel a little bit more positive. So I think that's really helpful. And in terms of fear of going out, I'm certainly hearing again, people are beginning to now feel a little bit anxious about going back out. And maybe people haven't been out for months. And this isn't actually just people with cancer either. I noticed for myself, I had to go out further than my sort of 3-mile radius of my house the other day. And I just felt a bit, it's been a while since I've been this far away. So, there are kind of anxieties for people around that. And something that comes up with that is for people who've had cancer, who are going through treatment now, actually they are coming face to face with people again. And maybe they live in small communities. And actually last year, maybe they could be very private about their cancer experience. But now going back out and meeting people, that's bringing a lot of anxiety, because some people are saying, actually, I look different. I look different to how I did maybe last summer. And so I'm going to go out and people are going to be looking at me. People are feeling very exposed, and people are wondering, how do I cope with that? What if people ask me how I am? And equally, what if people don't ask me how I am? There's a whole kind of mixture of kind of questions, and how will I deal with that gives rise to anxiety. So I think to deal with this kind of sense of fear of going out and everything that brings, the first place to start is to really look at those fears and really explore them. And you can maybe do that with a trusted friend or a loved one, or even maybe do it with a therapist who can help you kind of peel back some of the layers to the fears. Because actually when we do that, when we look at them, we're kind of bringing them out into the light a little bit, and maybe we see that they're maybe not quite as scary as we thought, and maybe we've been kind of catastrophizing them. They've become bigger than actually they are. So it can help us get things into perspective. And then I think it's about really being gentle and really kind of building up slowly to kind of expose yourself back into those situations. So taking it step by step. And if that's going back out to kind of shops and supermarkets and things like that, maybe the first step is just driving there and just being there and kind of assessing what that feels like. When that feels okay, then you go inside. And it's taking it really kind of incrementally. whilst at the same time making sure there's lots of activities and there's lots of time in your life to do things that make you feel really safe and really grounded. And that will be different for everyone. For some people, they might have quite a strong spiritual practice, meditation or breath work, things that help them kind of feel really safe. For other people, it might be being out in nature and walking, or it might be, you know, listening to music. We all have our own things that kind of help to calm us, a bit like you were saying, kind of bring us back into balance, and the parasympathetic nervous system just helping to kind of calm us. So making sure that we're doing plenty of those things before we're then exposing ourselves to these things that maybe feel a little bit anxious. And around dealing with other people, I think that's quite an important one. And it's something that's come up a lot for patients. And I would always say to them, you know, be mindful of your boundaries. I think sometimes we always feel a bit of kind of social etiquette comes in, and we feel like we have to talk, or we feel like we can't be rude, or we want to make the other person feel okay. And actually you have your boundaries, you know, and if there are certain people you don't want to talk to about what you've been going through, and if they ask you, then dodge the question and maybe ask them how they are and kind of turn it back. And people will soon get the idea that you don't want to talk. And equally, if there are people you feel you need to talk to, maybe people are going back to work, and it's helpful for people to know a little bit of background. So think about what you might want to say, and then rehearse that a little bit, actually say that out loud to see how that feels. I think it's just all about preparation and then exposing oneself kind of gently. And that would be my kind of ultimate tip, is just to really be gentle with yourselves in this sort of reintegration back into all these things.
I think that's so helpful, Hannah, and I think just even hearing you say that and realizing just how common an experience this is likely to be, and how many other people are going to be feeling this way, I think can be quite reassuring. And as you say, it's not just people in the cancer community, but many other people are feeling this way. And I think that whole, you know, realizing that's a normal reaction, and it just like recovering from any other sort of strange or unusual situation, you do just need to go gently.
Yeah, absolutely.
And I think it's also, you know, I've been talking to people about, actually, I think the world will be an easier place for people to navigate, you know, who maybe are needing to isolate more. I think many more meetings will be a kind of mixture of face-to-face and Zoom. Many more things opportunities will be still available. I think certainly at Penny Brohn, we didn't have any online services really before. We did the occasional telephone consultation, but had nothing online. And we've been able to reach so many more people from so many different corners of the country, even overseas. Some people have been joining our sessions from their hospital beds. Some have been right in the thick of treatment and would never have been able to get into a car and come travel all the way to see us. So we don't think we're ever going to go back to the completely face to face. I think we're always going to have, now that we've seen how useful it is, we're always going to have some online services, and probably still quite a majority of things online. So I think, and I'm sure we're not alone in that. I think there will, certainly as GP practices, I think the kind of, for people for whom it's more convenient to have a telephone appointment or a video appointment, I think we'll now we've got the technology, why would we go back if that actually suits people better? So I think there might be some of this, you know, we may not need to kind of go out quite as much if we don't want to, because things may have changed. Rob, I see you've answered a question that was in the chat around probiotics, and I think it is quite a common theme that people are told not to have probiotics while they're on cancer treatment. And I know you've spoken about this before. Do you want to say anything a bit more about that?
Yeah, well, as you know, one of my bugbears is patients being told things by people who say they only follow evidence-based medicine. And what they're telling them is completely against all evidence-based, and it's their own personal opinion which is coming through. And that can apply to, you know, exercise during chemotherapy. It can be applied to, you know, you're not allowed to go and get your hair done. I mean, there's a whole load of stuff. And, you know, someone telling someone not to take Actimel during Herceptin. I mean, what planet is that person on, right? I mean, all the evidence in the president of ASCO stood up. Well, no, he didn't. He was sitting down in front of a Zoom. But anyway, you know what I mean? Metaphorically stood up and said, the most important thing we need to do in oncology now is to prepare the patient for these biological treatments. Because the next era is, and Herceptin was one of the forefathers of the biological treatments, because we know they're much more likely to work if you have good gut health, if you exercise, if you're not overweight and younger. Well, we can't do anything about that. Or you can be biologically younger, I suppose. And you know, not only are they more likely to get an effect, an anti-cancer effect, you then don't get the horrible side effects like the lung toxicity, which you get with Herceptin sometimes. You get the bowel toxicity, which means you have to stop the treatment. I mean, that's all over the medical journals. So, you know, if I don't actually like Actimel that much because it tends to have sugar in things, but say if the same answer was for a good quality probiotic or eating bacteria-rich food, all the evidence is that if you eat those foods, you get a better response and less side effects. So to tell someone the opposite based on their own personal opinion is, you know, is not good. I'm trying to think of a polite way of putting that.
Irresponsible.
Yeah, and we get it all the time. You know, we get it all the time. Don't exercise during chemotherapy. Lie down after you've had your COVID vaccine. All this is, it's all opposite. You know, don't take vitamin D, issued by the government 6 months ago, which is, and this is what we need to whittle out. And at the same time, people who are giving this advice have got a pile of sweets on the reception in oncology units, force-feeding their patients cake during their chemotherapy, telling them to go home and rest and not exercise. So, you know, we need to find a way of making sure the advice in oncology and for the rest of medicine, for that matter, is accurate, and stop having this fear of self-help strategies and things which are helping them. And I don't know what the answer for that is. I mean, Genesis, you know, I'm a great fan of Genesis. I mean, they're the only people in Britain, only organization who've integrated exercise and other lifestyle strategies based on, you know, the world evidence, which is there. You know, it's none of what you're doing is radical. I mean, it's just common sense.
It's a brilliant moment to do a plug for a conference that Rob and I are both involved with, which is a conference aimed at oncology, but any healthcare professional who is looking after people with cancer. And it is a professional facing conference on integrative oncology, going to be held online on May the 15th. And if I can put the website in the chat. If people want to encourage their oncologists or their oncology nurses or their oncology dietitians or their pharmacists to come and learn about the evidence and meet people, and I think we've got to, I think, well, I totally get where you're coming from, Rob, but it's not their fault because they've never really been taught this stuff. And our medical education is sadly lacking in any sort of nutritional education. I think most average 5-year medical degrees have about 4 hours on nutrition, and most of that's biochemistry rather than anything practically useful. So things are changing, and hopefully with education and conferences to highlight the awareness. So if, you know, but it will only change, I think in England, it is a patient-powered movement in a way. So it's you badgering your team, saying, "I've heard there's this conference really aimed at presenting the evidence. You know, why don't you go along?" It's very, you know, it's not an expensive conference. It's online. People can go. The recordings are going to be available later. So a little bit of a plug, because we're going to only change the system if we can come together and respectfully educate each other, which is one of the reasons why we're doing these webinars and bringing together experts from who are experts in the conventional medicine field, with experts from the lifestyle medicine field, with experts from complementary therapies, to really help you help see how their different expertises can come together. So that's brilliant. Thank you for clarifying that. And I do think if you feel you're being told, given a sort of an instruction that doesn't chime with what you think the evidence is, it is, you know, it's sensible. Oncology pharmacists are often the ones who really are prepared to kind of look at the actual information and have got access to databases. Would you agree, Rob, that sometimes if you can get your question answered by a pharmacist, it may be better than...
Possibly. It depends on the individual pharmacist and how interested. I mean, we have some fantastic dietitians, but I caught one in the corridor saying all you need to eat is in a carton of food supplement, a food carton, like a Complan, and I sort of still hear things like that going on. So it comes down to the individual. I mean, the only light on the horizon, if that's the metaphor, is that drug companies now, which are realizing that their £200,000 a year drugs are going to work better if people listen to your advice and go to your conference and learn from it. So actually, I think that on a commercial basis, I'm not talking about humanitarian now, I'm on a commercial basis, they're going to have to listen to you, because they're going to sell billions of pounds more drugs, which is good for them, but that's not the reason I'm saying it, because they're going to work better and people are going to benefit from them more. So hopefully that'll be the incentive to go to your conference and integrate that into mainstream practice.
Excellent. So just, I'm aware, if anybody does have any more questions, please do put them into the Q&A. We'll pick them up. But one of the topics that I did want to cover is COVID vaccinations and cancer, because there's been some concerns in the cancer community of, are they going to get more side effects from the vaccines if they have them? Are the vaccines going to be as effective? What's your advice as far as we know around vaccination and people who are voicing some of those concerns?
Well, 100% go for the vaccine. If everyone has it, I mean, we're not in a dictatorial state, but I'm almost at the degree that if you don't go for your vaccine when called, maybe you should be paying the bill when you get admitted for your COVID treatment. But anyway, that's a bit. It's the only way out of this if we're vaccinated. There was a paper, as you said, which was inappropriately reported in the media, which said it does. You need to bring the two vaccines closer together if you had cancer. The trouble is, the word cancer is, the word cancer is very big. You could have a man with early prostate cancer who's got a 99.9% survival branded as cancer. Of course, that doesn't apply to him. You might have someone who'd had adjuvant chemotherapy 2 years ago. It doesn't apply to them. If the journalists bothered reading the paper, they would have seen that 60% of those patients, which they said had cancer, were having chemotherapy or biological treatments which affect their immunity within 3 weeks of the vaccine. Well, we already know that. That's not news. We already know that if you give chemotherapy close to a vaccine, you're not going to get such a good antibody response. So, that's just common sense, but all of a sudden it's enormous news. And then anyone with cancer then gets frightened, but it's only the people within 3 weeks of a chemotherapy or close to a chemotherapy if they're still immune suppressed. And in those group, I would share the decision of the authors. You should try and get the two vaccines closer together, because on a positive note, when they did have the two vaccines, even in that setting, they did get very high immunity. But having one and then like an 8 weeks delay, and I think we need to get that message over to whoever decides when the second vaccine comes, and that's something maybe we feed back to them.
Yeah, and I think the reality is that for a lot of people going through chemotherapy, they can't control that. They can ask, and their GPs can't control it either. So I think bottom line is probably some vaccine is better than nothing. And I think if you're lucky enough to be able to influence that, then great. But if not, you will be doing yourself some good. And again, just as Rob has said, I think the more resilient you are, there are some people who, even in the middle of their cancer treatment, actually are maintaining very good levels of health and very good levels of, even though the immune system is temporarily dipped, it bounces back really quickly. So again, I guess the message is, let's control the things we can control, and the things that we can't, like whether we actually have access to a second dose of vaccine right now, if we can actually make sure that we're we're giving ourselves the best chance to have the best response possible to our first vaccine, I guess that's all we can do. So again, that comes back to the vitamin D, the stress, the exercise, all of those sorts of things that we can do to help ourselves mount the best response.
On that question, sorry to hog it, there's, I'm working very closely with Rob Newman from Sydney and Stacey Kenfield from California, who are both lifestyle and exercise gurus, and they've just had their vaccination. They were telling me what they were doing, which got me looking at the literature. And actually, there's a lot of evidence that if you exercise at the time of your vaccine, I mean, you know, in the 24 hours before and after, you get a much greater antibody titer response. So that's something you can do. And if you're worried about thromboembolism, which of course was a bit of a myth, but nevertheless, if you were, get up and walk around rather than just sort of complain about it. You know, there's things you can do. And the other thing is, there is at least, there's a 2 meta-analysis, which one including a Cochrane meta-analysis, which looked at good quality probiotics in the weeks before and after of the vaccination. Now that evidence is for flu jabs, and that's well established. Probably what it really means is good gut health rather than the tablet, but nevertheless, the interventions were a probiotic, and it's completely established for a flu jab, it improves your titer. We don't know that with COVID yet. The common sense tells us it would, but that's why our next trial, which we're just putting through ethics now, is a combination of a probiotic intervention, the yogurt one, which was from the other study, and an exercise program. And we're going to measure antibody titers 6 weeks later. So again, we don't know is absolutely true for COVID. It is true for flu vaccinations. And, you know, it's not going to do any harm, is it, doing those things? I mean, it's not, it's going to, in a worst case scenario, it's going to be the same. But so that's the only 2 bits of advice I would recommend if you're going for your vaccination.
Sounds very sensible, and like you, as you say, and it ties neatly into a question that's come into the Q&A about who, you know, are we saying that the cancer patient is an expert in their own treatment and their own feelings? And I think it's really interesting because I think with exercise, we all know that, you know, most of us don't do enough exercise, but probably some of us do too much exercise. And I think actually, you know, I'm sure Rob's not recommending, you know, going out and running a marathon before you have your COVID vaccine, especially not if you've never run one before. And so really the person who can tell you how much is the right amount of exercise, obviously experts like Jeshila can guide you, but you can listen to your body. And I wonder, Hannah, whether you've got a view on, well, both of you, Jeshila and Hannah, what do we think about this kind of, is the patient an expert in themselves and their feelings?
So I think, can I answer the exercise bit first, because that is something we use very, very closely when I prescribe exercise. We use something called the rate of perceived exertion. So it's called a RPE scale. And all that means is the patient, we give the patient a scale of 1 to 10, where 1 is very light work and 10 is very hard work. And we tell the patient, like, you should be working out at a 5. Now, for me, working out at a 5 for biceps might be a 5 kg weight. For Rob, working out at a 5 might be a 10 kg weight. For you, might be a 2 kg weight. But it's what the patient is feeling, and we need to get them to be able to tell where they are so that they know when they progress. So the next time we say, okay, you've had your chemotherapy this week, you know, we can see you feeling a bit washed out, because, you're telling me you're feeling a bit washed out. So we don't want you to work at a 5 out of 10. For today and for these sessions, we want you to work at a 3 out of 10. So it's the patient who then will be able to tell us, actually, I feel I'm working at a 4 today. I think I need to take it down. And that's how we adjust the program. Now that goes the same when you're out and you're doing any exercise for yourself, is to be able to realize that how far you're pushing yourself, because you know on that day how you're feeling, and it differs from day to day and from what treatment you had, to see how far you're pushing yourself. So do look it up. It's called the RPE scale, or the Borg scale. So it's called the rate of perceived exertion. And it's something that we urge all our patients to get really familiar with, because it does help you grade where you are and vary your exercise.
I've just noticed the time and how actually in this conversation we're really close to the end of the session, and I know that we wanted to do a quick poll, and just to see from the audience if you're happy to answer these questions. It will give us a lot of information about where we go, how useful this session has been, how we should run the future webinars. So I know there's one little question about whether one vaccine is better than the other. I don't know, Rob, if you want to have a one-word answer to that while Sally comes back on. And
I just answered it. The data looks pretty much the same, to be honest. Yeah, I mean, the Oxford one's British, so if I had a choice, I'd buy it only for that reason.
Sally, are you going to just talk to us a little bit about the poll and say some final words of thanks? I really just want to wrap up the conversation by thanking all our panelists. It's been a fascinating discussion, and I hope people listening in and watching in have found it useful. Sally, do you want to?
Yes, thank you. So I'm just going to launch the poll now. So I do want to apologise. We've realised that the code on the invite and the code on the link were different. So that's why we've had a few people really struggle to join. So I do apologise to those people that joined late, but we are recording this. And of course, as I said at the beginning, we'll make sure that it's available because it's been so interesting. So I'm just going to launch the poll. I hope this works because I've done this before, so we'll go for it. So that's the first question. So if you could just answer.
Oh, you're not allowed, we're not allowed to vote, are we?
No, I've banned you from voting. Okay. So I think we've almost, you don't have to vote, of course, so that's fine. So we'll just move on to, yeah, everyone's voted. And so we'll just move on to the next one. Oh dear. Nina, I don't know if you can support me. I seem to have gone back to the first question.
There you go.
Here we go.
Bearing in mind they couldn't log on, probably the answers are going to be slightly negative.
Yes.
We'd love to, yeah, I think do get in touch via either the Penny Brohn website or through your GenesisCare wellbeing coordinators. If you've got any feedback or suggestions for future topics, we'd be really interested as well, and whether this is a useful format would be very useful.
It's only 5 questions, so we're nearly through. 4th question now. There we go. And the last question, sorry, it waits until everybody votes, actually.
So I did want to, yeah, I think does anybody on the panel have any final closing thoughts or tips or anything that they want to just say before we go?
I think I have just one more thing to say, is that try and do things regularly, because that's where you get the power of it. It packs a punch where it's good when you go out for a walk, but if you try and do that regularly, so go out weekly and make it something that's part of your life, that's where you get a lot of the benefits. So find a friend or find that class that you're going to regularly sign into and make it part of your life.
Yeah, and I think that's a little and often is quite good for all of these things that we've been talking about, for some of the things that Hannah was talking about, talking to people or breathing or doing other things. So, yeah. And I think I'd just like to close by just reminding you of some of the statistics that Rob talked about from New York as well, for most people still, I know there's been huge amounts in the media, but for most people, COVID is a mild illness, even with comorbidities. And the more you can do to keep yourself resilient, the more chance you have of you having, not getting it in the first place, or having a mild infection, or having a quicker recovery. So I think there's a lot of fear out there, and of course we need to take it seriously. Of course we need to follow social distancing and watch out, follow the government guidelines. But also we need to not be in a state of panic the whole time. And I think just really trying to get that balance right. This is it is a serious situation, but actually this virus for most people ends up being something that they will fully recover from.
So I'd just like to thank all the panelists for this evening. Sorry about the link. It will be working much better next time. So thank you for your attendance as well, and for your questions that you posed. That was really helpful for us. So if you'd like any further information about our organisation, I will share the link again that I shared at the beginning about GenesisCare or Penny Brohn. And just to let you know that our next webinar is always on the last Thursday of the month. So it's on Thursday, the 29th of April. And the topic is the integrative approach to cancer care. Treating the whole person is breast cancer. So that'll be 7:30 on Thursday, the 29th of April. So thank you all very much. I'll just share my screen with that information again, if I can find it. There it is there. And thank you all so much. Thank you for bearing with us, and have a very pleasant rest of your evening. Thank you.
Thank you, everybody.
Bye-bye.